Hi friends, welcome to the first episode of Dine with me. I am so excited to have my mother-in-law Aymee here. She graciously offered to be my guinea pig to try it out. So thank you for being here.
You're welcome.
And so this actually I don't know. I know Dylan, one of his favorite things is banana bread. Is it the same for you, or is it that he just has always loved it, so you've always just made it for him?
He's always loved it, so I've always just made it for him.
But you like it
yes,
too?
I do.
Okay.
I do like it, but he just, ever since he was a baby, loved bananas, period. And so banana anything. So as you already know, we have banana cream pie, banana bread. So yes, I just picked up on that early that like for birthdays and all special occasions, it was banana something.
Banana something.
Yeah.
So you're my test subject for my banana bread. This is a gluten-free banana bread because it's made all with oats. So do you want to try it before we get into our conversation?
Yes, I do.
I started doing it with whipped cream on the side, and it just makes everything better. Everything is better with whipped cream. Okay, so we have to dink it and then sink it, okay? Have you ever done this before? Okay, so you dink it, so
Dink, okay.
and then you sink.
Oh, okay, so kind of like clink and drink, but dink and sink.
Dink and sink, exactly.
So you know I absolutely hate the word moist.
Fun fact.
But I have to tell you that this is so moist.
The M word.
And it's dense, which I love. It doesn't taste like a very like airy, almost like you're not eating anything kind of banana bread. It's like very dense. And so the flavors are captured really well. Good job.
It's good, huh? I liked it because it didn't have, it has more texture, I think, because of the oats in it. That's what I liked about it too.
Is there cinnamon in it?
Yeah, so there's cinnamon, peanut butter.
Oh, peanut butter. Is that one? Okay.
And then Greek yogurt is the other kind of like secret ingredient. I guess it's not so secret if I announce it, but. So the cool thing about Aymee is that, well, there's many cool things about you, but not only did she give birth to my husband, who I adore, but she was the one that first started talking with me about bariatric surgery. And so I asked her if she could have this conversation with me just to kind of talk about her journey, her experience, because I know when I was deciding, when you first talked with me about it, I was very like resistant, wasn't a good time, wasn't interested. And then I started asking you a ton of questions, and it turned out to be the right decision for me. So do you mind just kind of starting with that and just sharing kind of what your experience and journey has been with bariatric surgery?
Yes, sure. I want everyone to know that I never talked with Shay about it because I thought, oh, she needs to lose weight. Shay is a beautiful girl. I've always thought you were a beautiful girl. I don't care what size you are, you're beautiful. But in regards to your infertility issues and PCOS, I had heard and done some research that it could be a benefit. So just want to throw that out there.
And I never took it that way, that she was saying it like that.
When COVID hit, I was at my heaviest weight. And COVID made matters actually even worse for me because it was a lot of, sitting, a lot of indoors only, not going into the office anymore. And I had a doctor's appointment, and I've always had trouble with my kidneys. It's been a lifelong battle for me, but I had my numbers done on an annual checkup. And my doctor said, you're in stage 3 kidney failure. And I was like, that's great. Okay. At the time, I was 48 and, or maybe 47, going to be turning 48. And so that's not what you want to hear. There's 5 stages of kidney disease, and the 5th stage is either dialysis for life or kidney transplant. So kind of young to be getting that kind of diagnosis. And so I struggled with weight my whole life, been up and down. I have struggled with an eating disorder for ever since I was 15. So I'm now 50, big 50, woohoo. So, but I've been in recovery from my eating disorder since 2011. So it's still a struggle every day. The eating disorder, the urges are still there, but it's been under control, thankfully. So, but when
a lot of work, it's been a lot of work.
With a lot of work.
You've done a lot of work with that.
Yes, I have. My doctor was basically like, just like what every doctor says. If you want to get your kidneys in better shape, you need to lose some weight. Okay, we hear that all the time, right? And so it's like, okay. So I don't know, something, I guess maybe the Lord, but something was just telling me I need to check into bariatric surgery, because I had done so many diets my whole entire life, including very unhealthy binging and purging, i.e. the bulimia. That controlled my weight for a very long time, but it's not sustainable, obviously. And, that in itself would put me into an early grave if I continued with that. So that wasn't, something that I could do. And just all, I've done keto, and I've done, low calorie, low carb, you name it, cut out the sugar, all this stuff. And it just seems like I yo-yo, just up, down, up, down. And so I did some research and decided that I was going to go talk to a bariatric surgeon. So I did, found one. I was living in Los Angeles at the time, found one down there. Got a great vibe from him when we had our first consult, felt really comfortable with him. He seemed very knowledgeable. He felt like the weight that I was at and the amount of weight that I needed to lose to be in a more of a healthy weight category was very attainable with the sleeve. So I had a vertical gastric sleeve or sleeve gastrectomy, however you like to call
Sleeve sisters. I just made that up. I don't know if that's a coined term.
But yes, like VSG, whatever you want to call it. I chose that over a gastric bypass because I didn't want to have my insides messed with any more than was needed, I guess you could say. And with the bypass, they do have to, your intestines and stuff get involved with it. It's not just the stomach. And so I wanted the kind of the least invasive approach. And so sometimes people can lose more weight with a gastric bypass, but my surgeon and I discussed it at great length, and we just thought for me and where I was at and what I needed that the sleeve was going to be a good route to go. And so I will be 2 years out next month, so a couple more weeks and it'll be my 2-year surgiversary. And I've lost 70 pounds. So I am in, a healthy weight zone now. And the best part about it all is my kidney function is perfect now.
Which is incredible. That rarely happens. Yeah.
It's absolutely incredible. And those numbers changed within 6 months of surgery. Mm-hmm. Within 6 months, I went from stage 3 to your kidneys are working fine. And it's like, call it a miracle, call it whatever you want, but I am so thankful that I had the surgery because I am living a very healthy life now, and I don't have a fear of, dying prematurely for something that I could have helped control. And so surgery was a great choice for me.
Yeah, that's awesome. Well, and that's what I've just been thinking about a lot too, is it's amazing how it's not something that's commonly prescribed or in the primary care world. It seems like there's still a bit of a taboo sense around bariatric surgery, or it's not talked about, but yet prescription medicines will get, kind of thrown out there. And I just wonder kind of from your perspective, seeing that big shift, right, in your kidney function, it's like no medication really could have had that same effect to get you there. What would be your advice to someone who's maybe struggling with diabetes or high blood pressure, things that maybe medication is an option for, that maybe have thought about bariatric surgery, seeing such a big change? Like, what advice would you have for those folks?
Well, I definitely think that, if you're able to control your diabetes or, whatever you're dealing with, if you're able to control that and you don't feel that, that that's a step that you need to take, then more power, to you, definitely. But there's just so many benefits to the surgery, not just from a weight loss perspective, but, another statistic for me was my cholesterol was very high and I was on cholesterol medication. And about 6 months into my journey after surgery, no more cholesterol medication. I'm sitting at 189 total cholesterol right now. And that's a very healthy, especially for my age, that's a very healthy cholesterol to have. And so, there's numerous benefits, but I never would want to push anyone, towards the surgery if, for instance, diabetes or insulin resistance, if you're able to control those with a more, milder approach, then that might be best for you. But if you are somebody, though, that has struggled with weight, for most of your life, or, you're yo-yoing up and down, the yo-yoing up and down is not good for your body. It's just not good for your body, gain 50, lose 50, gain 100, lose, gain 20, lose 20. I mean, it's just, and it's so bad for your metabolism. I mean, there's so many things that it affects. And so, I would encourage folks just to talk to your primary care provider first. That's definitely where you want to start, and just see if it might be an option for you. And some primary care providers, like you just mentioned, Shay, I'm not sure what it is, but a lot of them are hesitant to recommend it. So if you run into that, don't be afraid. If your insurance lets you go to see a specialist without having to get a referral from your primary care, then do that. Honestly, just make an appointment with a bariatric surgeon, just a consult, and talk with them and see if they think you're a good candidate, even if your primary care maybe doesn't, feel the same or whatever, but explore all your options, I guess, is what I would suggest.
Yeah, definitely. Yeah. And we both know, because we've talked about this quite a bit, that this journey is not one that's just about the physical aspect, right, of just losing weight or, numbers improving. Those are all great benefits, of course. Can you walk me through a bit about what's been the most challenging part when it comes to more of that mental and emotional side of bariatric surgery?
Yes, I can. They call your first year, the honeymoon phase. Really, the first 6 months is your primo honeymoon phase for weight loss. And then, it'll start to slow down, but you're pretty much losing weight for the first year. After that, it tends to kind of, drop off a bit. But one thing that I didn't really have time to do it, because for me, time was of the essence to do something about my weight to help get my kidneys back into shape and where they needed to be. But had I had a little more time to prepare, I needed to prepare more mentally for this surgery. I did not prepare mentally at all. And I went through a huge grieving process after surgery, and was crying a lot, just depressed. The first few months were just, I was grieving the loss of the food, and I couldn't eat everything I wanted anymore. I couldn't eat what, the sugar is my nemesis personally. It's sugar for me. And, if you jump into sugar too quickly after you have surgery, you will not feel well at all. And so just knowing that, and that I couldn't turn to ice cream and donuts and cake and stuff, it was really tough. Sometimes I felt like I don't know who I am anymore without the food.
Yeah, well, I think your identity gets so, and not just yours, like I felt that too, where it's like you begin to have this identity that's so wrapped up in food and, all of the social components that are wrapped up in it too, that it's a hard transition, because then you don't have that crutch anymore, or that coping mechanism, right? Like
Absolutely.
It's just gone overnight, literally,
Yes.
right? Like, yeah, it is tough.
It's definitely tough. If I can recommend to anyone, finding a therapist that either has, a little bit of experience in dealing with post-bariatric patients, that would be very helpful. And that's something that I definitely should have done. And in hindsight, I would have done that, because I do think that would have helped. But I definitely don't want to give off the vibe that, I lost 70 pounds, like life is great. It is a work in progress, honestly. It is a daily thing for me. The mental side, the food obsession and the food addiction does not go away once you go under the knife. It just doesn't. For me, perhaps there are some people that can, come out of surgery and they're like, yes, I mean, granted, your hunger hormone, the ghrelin, gets, taken away. There's a period of time where you're not food obsessed, but being 2 years out, I'm here to tell you it comes back. And if that's something you struggle with, is food addiction, food obsession, whatever, that will slowly creep back into your life. And you then, you have to deal with it if you don't want to experience major regain. And that's another thing to please keep in mind, is this is not a one and done situation. You don't just lose the weight and then for life you never have to work at it again. I have to work at it every day if I want to maintain the weight loss that I achieved. And so that isn't the easiest. And I would say for me, that's my biggest struggle where I am now in my journey, is just to be able to maintain the weight loss.
It's a different mindset. It's a mindset shift at that point.
100%.
And I think when, you and I have talked about this a lot, when your whole life has been the goal of losing weight and you never accomplish it, or accomplish it to the degree that you want to, it becomes this unattainable goal. And then when you hit that goal, that's almost like, I don't know if it's a grieving process, but it's almost like you have to come down off of that a little bit. Like, wait, I've achieved it. And I think what it is too, is it's like, oh shoot, and my problems are still there. I thought when I got skinny or when I lost the weight, that my problems would go away with it too. And then I come to find out, actually, it's bringing up more problems. Like, what the heck, And so that's a tough thing to work through.
Yes. Yep. And it's probably something that I didn't expect to deal with. I wasn't able to foresee it being the mental and emotional, piece being so strong, as it is. I didn't, when you're prepping yourself for surgery, you're really just prepping, okay, do I have my bone broth? Do I have my protein shakes? Do I have, it all revolves just around the physical part of the surgery and the weight loss, and getting in your water, getting in your protein, getting in all the nutrients you need, post-op and all of that. But then once you kind of get into a groove and your weight either stabilizes or your weight loss slows down quite a bit, then it's kind of like, oh, all right, where do I need to focus now? Like, where does all the energy that was going into all of the bariatric, prepping, where does that energy go? And for me, it's had to be shifted into, I need to work now on just maintaining this loss, because So I went on vacation, recently, and Shay and I talked about this, and I'm just going to have a good time. I'm going to enjoy myself on this 1 week vacation, not go overboard, but definitely, enjoy the food that's there, and stuff. And so, but I did put on a little bit of weight. And so I am now working to get that back off again, but it doesn't come off as easy as it did when you're right post-surgery. And so, that's another thing to just be mindful of is, losing the weight, losing any regain that you may have. And regain is common, you guys, please know this. It's a very common thing. It's also very common to get to the lowest weight that you get to and then gain 5 to 10 pounds to your set point weight. That's how my surgeon had explained it to me. And so sometimes your body just wants to settle at a certain weight. And so,
and that makes sense. Like our bodies aren't statues, right? They're not meant to be the same our entire lives. Like different life changes will bring different seasons of what our bodies look and feel like, when we have babies and when we're going through menopause, like there's all these different life changes that happen, and our bodies are so cool where they adapt with it, right? And so it just, different seasons bring different things, and that's okay. That's a good thing.
Yeah. Yeah.
Well, with all the mental and emotional work that I know you've done, what's been helpful for you when you've kind of fallen in those slumps of feeling not motivated or feeling discouraged, or kind of maybe going back to habits that were once really familiar? What have been some of the things that have helped you in those times where it's been hard?
Definitely learning to reach out and ask for support.
Isn't that the hardest part?
It is.
Oh, it's so hard.
It's very hard. It's very, very hard. And it's never come easy for me, but I have learned through recovery from, bulimia, and then now this journey of bariatric surgery, that if I isolate too much and just get in my head too much, it's just a downward spiral for me. It just really is. And so it's not easy for me to say to my husband, I'm having a difficult time, I'm having a rough day, I need some support. Just give me a hug because I'm not feeling it today, that it's hard, but it's so needed. And that's something that for me has been very helpful, to talk with friends, family members, people that know the struggle. And anybody who's ever struggled with weight, can understand. And so you can go to them and have these chats and kind of, get little nuggets of wisdom off of each other. And so I would just say, reach out. If you're struggling, don't try to take it on alone. Don't be ashamed that you're struggling. There are some people that have this mentality of oh, well, you've had weight loss surgery, so aren't you fixed now? Aren't you fine? No, it's a journey. It's a process. It's still a daily, that VSG is a tool. It's a tool that you can use to help get you on the right track, but it's up to you to do the mental and emotional work to break the food addiction enough to stay on track. Yeah. That's kind of my thoughts on the matter.
It's funny, I've been noticing more with myself that one of the things that's prevented me from asking for help has really been pride. That's been a word that's been coming to the surface a lot for me. What do you think makes it hardest for you to ask for help, or what is there one thing in particular that kind of stands out?
I would say that I agree with you. I think it is pride. I think it's wanting to appear to the outside world, or even to friends and family members, that Amy's got it together. She's got it together. She's doing great. She's had the surgery. She's lost the weight. Everything's just peachy. And it's hard to admit even to myself that not every day is peachy. And so,
and that two things can coexist at the same time. That's what it doesn't always have to be one thing or another.
Yeah.
You can have a really hard and challenging day where there's lots of tears, and also be really grateful and joyful too within that. Like they can occur at the same time. So what was your most pivotal moment in your life thus far, and why?
I had an eating disorder since I was 15, and I didn't get help for it until I was almost 40 years old. And so getting help and going into an inpatient treatment facility for me was probably the most humbling experience of my life, the most uncomfortable experience of my life, but the most life-changing experience of my life. And I don't think I'd be here today if I didn't do that.
Yeah. So this next one, finish the sentence for yourself. Okay. I'm happiest when?
I am happiest when I am with my husband or my family, my friends, hanging out, just having a good time, good, authentic, communication, just chit chats and just being ourselves. Yeah, that's when I'm happiest.
What's been a disappointment, or it could be big or small, but a disappointment that's shaped your life or the course of your life, would you say?
So, for me, I had a rocky relationship with my dad growing up, and it wasn't because I didn't love him. It was almost because I loved and needed his approval too much that it affected me the way that it did. But he worked a lot when I was younger and wasn't there physically for me. He traveled a lot, was gone a lot. And so for me, that really, it shaped the way that I viewed marriage. It shaped the way that I viewed men. And thankfully, my dad and I have, had a chance to really repair and work on our relationship as I've gotten older. But that feeling of not being important or a priority in my father's life, always trying to meet expectations that I felt at the time were unattainable, made me feel belittled as a person. And my father and I have talked about this, as adults, we have talked about this and had these conversations, and I don't feel that he meant any ill will by it, but at the time, that it's just the way that I internalized what was happening. And so I just wish that I had more of his presence in my life growing up. I think that would have been very beneficial for me. And I may not struggle with some of the issues that I struggle with today if that hadn't been the case. But again, something that I'm working on and moving past, which is good. Yeah.
If you could look at Aymee, whatever age, but as a child,
Okay.
and you could kind of hold her face and look at her,
Yes.
what would you say to her?
I know exactly what I would say to her. I would say that you are beautiful inside and out. I don't care what size you are. I don't care whether you get straight A's or not. You are a caring and loving person, and those are the things that matter most, not what size are your jeans, not, what is your GPA in school. a lot of things that I felt very pressured on as a young girl, I would just tell her, those, in the grand scheme of things, those things don't make you who you are. And for the longest time, I have always felt that if I am not the best of the best at work, if I'm not the best of the best at school, if I'm not as skinny as I can be, if I, then I'm no good. I'm defective, I'm faulty, something's wrong with me. And I would tell my little self that no, nothing is wrong with you. You are perfect just the way you are.
That's awesome.
Thank you for having me. This was really great. Your banana bread's amazing. Really, really good, and definitely need the recipe for this. But yeah, this is the first time I've ever done anything like this. So, thanks for inviting me and kind of bringing me out of my shell a little bit to, kind of be vulnerable on camera. That doesn't come natural to me, and so. But I feel like it was a stretching moment for me.
Yeah.
I'm glad we did it.
You did great.
Thank you. Bye, YouTube.